Must do a focus assessment on the system or the systems that are affected. So if the patient have a broken limb, you must do a focus assessment on the musculoskeletal system. Welcome back to my channel. For those of you who are new, welcome. Please remember to like, share, subscribe, leave a comment and press the notification bell so that you can be notified when I post a video. So in today's video we are going to talk part 2 of nursing care plan. This video I'm going to focus mostly on the assessment data. So guys, if you haven't watched my previous video, I spoke about tips and tricks on how to properly develop your nursing care plans in nursing school. I really encourage you to go and watch that video. As I said in my previous video here, assessment data is your first stage in the nursing process, and in my opinion it's the most important part of developing your nursing care plan. Your assessment data is made up of subjective and objective data, and your subjective data must be in relationship with your objective data and with the nursing diagnosis that you are planning on writing for this patient. Your subjective data is information that you gather from the patient and or the patient relatives, while your objective data is information that you gather through observation, through physical examination, and through laboratories and diagnostic testings. And guys, what I want to encourage you not to do is do not reword your subjective data. For instance, if the patient verbalizes, "Nurse, I am having shortness of breath," right? Patient verbalize, "Nurse," in quotation, "Nurse, I am having shortness of breath." Do not reword what the patient said, because in rewording what the patient said, sometimes we as the nurse miss the concept of what the patient was really saying. We don't want to do that. We want to write exactly what the patient said. Your subjective and your objective data must link together. So I can't see you writing your subjective data that patient verbalized having shortness of breath, but in your objective data I am not seeing any assessment on the respiratory system. Guys, all part of your care plan must link together. Assessment must be linked to your nursing diagnosis and so on. There's a relationship in your nursing care plan. It must flow, it must link together. Everything must link together. And also, you must do a head-to-toe assessment on the patient, but you must do a focus assessment on the system or the systems that are affected. So if the patient have a broken limb, you must do a focus assessment on the musculoskeletal system. If the patient is having shortness of breath or dyspnea, you must do a focus assessment on the respiratory system. Remember that we assess our patient using mostly 4 senses. So we use seeing, hearing, smelling, feeling. We see when we inspect, we feel when we palpate, we hear when we auscultate and percuss, and of course we smell using our nostrils or our nose. You must start your assessment by inspecting. You must write what you see first. So when you're doing your focus assessment, all of this must be seen coming out. All of this must be seen in your documentation with how you inspect the patient. What did you see? When you palpate, what did you feel? When you auscultate, what did you hear? We must see these things outlining in your assessment, in your focus assessment. So guys, thank you so much for watching this video. I hope that you're learning something. Please press the subscribe button and leave a comment. Guys, if you have someone also who is really poor at doing care plan, I really suggest that you share this video with them, or just have them come over and watch these videos. Thank you again for watching, and stay tuned for my next one. Bye.